Today, we're going to talk about respiratory diseases. So, first of all, let's talk about respiration. What is respiration? Respiration is defined as the exchange of gases between an organism and its environment. As you can see right now, this is our respiratory system. Our respiratory system consists of important respiratory organs such as the lungs and the trachea. Inside our lungs, there are tiny little air sacs called the alveoli. Alveoli is the site of gases exchange. The gases that involves in the gases exchange is the carbon dioxide and the oxygen. Now, you know that something wrong could happen to your respiratory organs? These are called respiratory diseases. Respiratory diseases is a term that encompasses a variety of pathogenic conditions that affect respiration in living organisms. In our video, we would like to focus on 5 types of respiratory diseases. The first disease that we will focus on is asthma. Asthma is a common chronic respiratory condition that causes difficulty breathing due to inflammation of the airways. The symptoms are dry cough, wheezing, chest tightness, and shortness of breath. Asthma can be caused by a lot of things, such as airborne substances like pollen and dust. It can also be caused by respiratory infections, such as the cold. Air can cause asthma, such as smoke. And stress can also cause asthma. Next is chronic bronchitis. Chronic bronchitis is a form of chronic obstructive pulmonary disease, or COPD, emphasized by a chronic cough. The symptoms are coughing, production of mucus, which can be clear, white, yellowish, grey, or green in color, fatigue, and shortness of breath. Chronic bronchitis can be caused by smoking, dust, and acute bronchitis. Another respiratory disease is emphysema. Emphysema is a serious respiratory disease which is another form of COPD. Symptoms are wheezing, fatigue, and sleep problems. It can be caused by air pollution, dust, inhaled chemical, and childhood respiratory disorder. Emphysema can also be caused by smoking. Next is cystic fibrosis. Cystic fibrosis is a genetic respiratory disease caused by a defective gene that creates thick and sticky mucus that clogs up tubes and passageways. The symptoms of cystic fibrosis are salty tasting skin, chronic coughing, frequent lung infections, and a poor growth rate in children. Last but not least, we have pneumonia. Pneumonia is a common lung disease caused by an infection in the air sacs in the lungs. The infections can be bacterial, viral, or fungal. The symptoms of pneumonia are cough, fever, shaking chills, and shortness of breath. One of the doctors says that it's really important for adults over 65 or those with other chronic disease to get the pneumococcal pneumonia vaccine. So, now, we've already showed you a few respiratory diseases, but how can we avoid them? First of all, we can quit smoking. Number 2 is to avoid lung irritants such as smoke. Number 3 is to follow a strict diet that consists of a lot of healthy food. Number 4 is to watch what you drink and avoid alcohol. Number 5 is to exercise regularly, at least 3 times a week. Number 6 is to always practice breathing exercises. Number 7 is to go for acupuncture and acupressure sessions. Number 8 is to take vitamin D. Number 9 is to avoid extreme weather such as extreme hotness. Number 10 is to avoid respiratory infections by wearing a mask when you're outside in public.